When a patient's using a gait aid, one of the important things to consider is that the gait aid is set at the appropriate height. And this is really important, one, for safety, but also that the patient uses the gait aid appropriately. Namely, that they're able to use the gait aid to accept their body weight appropriately and therefore follow the restrictions placed on the patient post-surgery. So with the frame, in this case, we want to make sure that it's the right height for the patient. Sometimes it's difficult for us to know exactly the setting for the frame, given the patient's lying on the bed and we actually haven't seen them standing yet. So it's important for us to make that decision, one, when they're sitting on the side of the bed, but two, specifically when they're standing. We can take a rough guess, but it needs to be adjusted once they're actually, you're in a position to assess the height of the frame. Once you get the patient standing, if by chance you find that the frame is inappropriate or the height is inappropriate, it's advised to get the patient to sit down again, readjust the frame to the height that you feel is appropriate. So it's at this point here, we're just about to go through the transfer process. I'll get the patient to push up off the bed as much as they can, up into standing and grab a hold of the frame. Now on a quick guide, we want to make sure that the patient's elbow is slightly bent so that they're able to take their pressure through their tricep and not through their shoulder. We don't want their elbow completely locked, which will then cause the weight-bearing pressure to go through the patient's shoulder. But we also don't want the elbow too bent, because then they'll be unable to use their tricep to accept their body weight. A quick guide to go by is if we get the patient to let go of the gait aid, let their arm just hang by their side. What we want to do is to find out that the actual handle here sits at about the location of where you would normally wear your watch, so just above your wrist. And in this case, on Stephanie here, it's perfect. So once she actually puts her hand onto the frame, she's got that slightly bent elbow, her shoulders are relaxed, and she's able to accept the body weight using her tricep rather than using her shoulders dramatically or locking her elbow out. In this case, we're going to be using forearm crutches. We get a bit of an idea of what a patient's height is like on the bed, but this will need to be reassessed once the patient is physically standing next to the bed. You can give yourself a rough guide as to what setting to have the crutches on, but as I said, you will need to readjust this once they're standing. So when we're about to transfer onto the forearm crutches, obviously I want to have the crutches close by so Stephanie can grab those once she's actually into standing position. So I get the crutch into position, get her to use her hands to gently push up off the bed into standing. She can put one hand into the crutch. Then I'll bring the second crutch into position. Again, I'm standing very close, usually on the side of the operation. And at this point here, I reassess to just make sure that she's not having a vasovagal or she's feeling lightheaded. But I also make a quick assessment about the crutch's height. As we can see, these crutches are pretty much set perfectly for Stephanie. And the idea with these crutches is to make sure that she has a slightly bent elbow. The concept is we do not want a straight elbow where the forces will be transferred into the shoulder. And we also don't want the elbows too bent, in which case she won't be able to use her triceps or her arms to accept the body weight. If we find that these crutches are not appropriate or we need to adjust them, it's at this point here I'll get Stephanie to take her hand out of the right crutch, put her hand back to the bed, and then I'll take the other crutch so she can also put it back and sit, at which point there I'll readjust the crutches. In this case, we might drop them down one notch. Again, I'll get Stephanie to push herself up into standing, pop her hand in, and the other hand. A quick guide to go by is if we get Stephanie to take her hand out of the crutch here, let her arm hang just by her side. The handle here should sit pretty much where her watch would sit. and that's a rough guide as to the appropriate height that we should have. In she goes, and probably the only other thing is the actual cuff itself can be adjusted, and we want to have that just slightly below the elbow. We don't want to have it too short because this is the only point of contact that Stephanie will have to the crutch outside of her hand. So this is what gives stability to the forearm crutch, is the contact just below the elbow and obviously the hand onto the handle.